All right. Next exercise is going to be the hip circle. This exercise is really great during pregnancy, as well as I give it to all my pelvic pain and low back pain patients for what it does to help with opening up the pelvis. So what you're going to do is you're going to start to rotate your pelvis in a circle. Good. I like to try to break it down. So what you want to think about doing is pointing your hips towards one side wall, so to your left side wall. Then you want to think about taking your hips and pushing them towards the back wall. You want to think about rotating your hips to where they hit the opposite side wall or the right side wall. And then you want to think about tucking your pubic bone in. So if you think about it, it's like 4 points that you're trying to hit. Then you make sure you're doing a deep enough hip circle. So this is one of the exercises that in clinic, I'm always having to make sure patients are doing right. Because sometimes what we end up doing is this, and this isn't really a deep hip circle. This is a lot of upper arm and shoulder movement. This is a hip circle. Great job. Making sure you're breathing. You should really feel this in the pelvis. And then you're going to, after 10 repetitions, you go into reverse. Same exercise, but you're going the opposite way. Going from one side wall, sticking your butt out, other side wall, tucking. One side wall, sticking your butt out, the other side wall, tucking. Good. I'm going to do 10 to each side. That's going to equal 1 set. I want you to try to see if you can get through 3. You'll really feel it in the hips and in the pelvis, in the abs. You'll feel a good stretch. So this is one of those really good ones that are good for a lot of stuff. And it's a movement that for a lot of us, we don't do. One of my patients, she called the exercise the Shakira. She said, if you don't feel like you're doing something a little sexy, you ain't doing it right. And it stuck with me since she told me that. So I call it the Shakira. So go ahead and try that one and let me know what you think.